I got interested in social work like a lot of people in the field do because I wanted to develop some skills at helping people that have serious problems of living. And I started to work in the field. Social work is part of a broader field called the human services, and I'm talking about human service organizations, county agencies, child welfare services that work on child abuse and neglect, behavioral health, mental illness, substance abuse, homeless services, things like that. And I got interested in how the organization operated, and then I got interested in what managers do to influence and lead what the organization does. And then I got interested in, well, what are these organizations actually doing? How are they performing? How do we measure performance? And then I got interested in, well, how can we help these organizations perform better? And then that led me to getting interested in organizational change. And I did it in practice, and now in the way my career here has evolved, I kind of went through those same stages. So I'm really interested in organizational change tactics, the things that change leaders, usually executives, guys like Stanley and Steve, would the provost, new athletic director maybe, what they'll do if they want to create change in the organization. What things would they do that'll make the change more likely to be successful? Before I define organizational change, let me just ask you to raise your hand if you have experienced organizational change. Okay, good. We got it. We had a salary increase, organizational change, furloughs, organizational change, a lot of things that really affect people in their work. And change can be unplanned, things just happen, or it can be planned, and it can be simple and routine, or it can be transformational. And so I'm looking at planned organizational change that people within the organization say, like in our field of human services, we need to adopt a new practice model for how we assess risk for child abuse and neglect, and then develop the model and then train everybody in it and implement it. And it's changes like that, major change in strategy, redesigning of the organization can go toward transformational, just a huge difference in how the organization is going to operate. So here's a definition actually from the field of organization development. Planned organizational change involves leadership, usually management, executive staff, mobilizing staff to explicitly address problems or needs in the organization's current state, to move the organization to a desired future state, in our case so that we're providing better services to people in the community, using change processes that involve human and technical aspects. And the technical aspects are usually pretty straightforward. In our field, agencies have gone through automating their information systems. That's a pretty technical change. But the human part of the change is how do you get psychotherapists and counselors to say, now you're going to have to enter your data into the computer, and we're going to have to have computerized files. And that has a lot of implications for how people do the work. Why I think this matters, human service organizations are in very dynamic and complex environments, everything from budgets, policy changes, social problems and conditions. So there's a lot of pressure put on human service organizations to respond and to get better, to do new things and do things better. Our work has huge impacts on clients and communities. Sometimes could be a life and death impact. In child welfare right now, the state is facilitating the county child welfare agencies developing a new service delivery model. And the different models have been tried. When a model and a practice goes the most tragically wrong, a social worker makes a decision to leave a kid in the home and the kid gets killed. So they're trying to develop models so that workers in the field have systematic, evidence-based processes that are going to help them make better decisions, going to help the services be more effective and efficient. In our field, we're accountable to the public, to society, to taxpayers, to people that give money to nonprofits for using scarce resources well. And then finally, I teach this stuff And a lot of it, I'll go into a little bit about evidence, has been not really great evidence for what we're teaching. Our field in the social sciences, especially in this area, is far behind the physical sciences in terms of the way evidence can get gathered and used and apply. So what I've been looking at the last few years is what organizational change tactics, if they're used by human service agency administrators, could improve the performance and the operation of their agencies. I started by just kind of looking at the state of the knowledge base. There's a huge literature on organizational change. There's a lot of theory, models, talk about how you do this. There's some research with individual case studies where a writer will profile an organization that did a change and they talk about what they did. There are a lot of academic studies that study just little pieces of it, like they measure an organization's readiness for change or capacity for change, or they measure organizational culture, organizational climate, and there are studies that correlate variables like that. Kind of at the other end of that, there's what they call the guru literature or management by bestseller, and these are the books that say, buy this book and you're going to be able to be a great leader and make all these amazing changes. And it's usually either I'm an executive, I did this, and here's what I did, or I'm a consultant, I've been doing this for 20 years, and here's what I did, and you can do it. I kind of concluded that either they're too esoteric, they don't measure some of the key variables, or they're too anecdotal and they don't give some practicing manager really good practice guidelines. An executive in a human service agency can look at, well, they did this at General Electric or Procter & Gamble or somewhere else, so now how do I translate that to, and what did they do that really was successful and made a difference, because there's so many variables. So I'm kind of concluding the evidence is a little bit weak in this area, so I want to try to contribute to it. I've done some case studies just analyzing organizations that did organizational change and write them up. I had a student help me to do a content analysis of the literature, both on organizational change in the general management field and also in the human services field. And we looked at, based on the preliminary things I'd seen about themes that people wrote about organizational change and what a change leader should do, we looked at how much of that really showed up in how much of the literature. And we kind of boiled it down to 21 tactics, I'll give some examples in a minute, that the literature says if a change leader does this in their organization, all these 21 things, your odds for successful change are going to go up. So I just wanted to kind of see if I can gather some evidence about that. In social work, a big theme in our field is evidence-based practice. We're, like I said, behind some of the physical sciences on using evidence. And so I wanted to try to build to that. So I developed the Organizational Change Tactics Questionnaire that has these 21 items on it. And there are actually two versions of it. One of them is we ask people in an organization, pick a successful change you saw and an unsuccessful change you saw, and tell us if people did these things and then what effect they had. And then the other version of the questionnaire is just used in one organization. And we ask everybody after a change process is completed, did you see your change leaders do this? And then do you think this change was successful or not? And you can see I've used this questionnaire with some of my students in a leadership development program I've worked with Southern California counties, a couple of agencies and a professional organization, and then some colleagues in Colorado let me administer this in a bigger study they were doing. These are just some of the examples of the tactics that show up as more in successful versus unsuccessful change. Clear need and desirability, people feel the urgency, clear vision and outcomes. There's top management support for it, and individuals that are affected by the change are involved in it. So far what I'm seeing is, well, it's hard to measure success of organizational change in this field. Sometimes it's just very complicated. The use of some tactics has been associated with successful change, the way people are reporting it. But I found that those that were more involved in the change process, or those that were at a higher level in the organization, saw the tactics being used more, and they saw the changes being more successful. So that's an important point for if you think you're a change leader, you might think it's going well, you're doing all these things, but people at lower levels don't see that it's happening and they don't see that it's successful. So I think it's, I'm concluding it's a promising instrument. We need to do a lot more study on this. Thank you, Steve and Stanley and everybody else that puts these things on. And now it's time for questions.
Questions for Tom?
Tom, I can see in a social service organization or even a company, you have fairly well-defined tasks or purposes.
Yeah.
What do you do in a place like a big university? How do you even measure or define what the purpose of it is?
Yeah.
Because it's so multifaceted.
Yeah, that, and in our field, social work, I have a brother that spent his career in the meatpacking industry, running slaughterhouses or abattoirs, if you want to use that word, and very routine technology, and human services, counseling, working with drug addicts, things like that. And here, that goes herding cats and everything else. It's probably even harder in a university. An OD consultant years ago wrote a book on this work in healthcare, and I asked him one time, what are you doing now? And he said, I'm out of healthcare. It's too big a mess. You can't do anything. So I think, really, I think what President Weber did with trying to build some major strategic themes for the whole university. I remember that's a long time ago for some of us, but very thorough process, a lot of heavy involvement from people, a lot of communication about what we're going to try to do. And I think some of that shaped up to lead to some things that are probably still in existence. But I think in our field and in the university too, starting with what is our mission. Sometimes we need to revisit the mission. What's our vision for our future success? What are our core values about how we're going to operate? One of my studies was on how human service agencies integrate and coordinate, because some agencies do all kinds of different things, and I think that's really true here. I guess as a consultant, I would say I'd want to get people together and say, what do you see now? What would be a more desirable future, and then create some processes for having a lot of dialogue about it. It can be really time consuming. People have to be committed to it.
I'm going to take a prerogative for just a second. So we just went through a strategic plan initiative in the last couple of years, right? Last 4 or 5 years.
Yeah,
On your 21 things, can you identify something that you thought we did maybe fairly well and something we didn't do so well? I don't know if that's a fair question or not.
Yeah, I think there was top management support for it. I think there was a pretty clear vision, and the vision, I haven't looked at it for a while, but I think the vision was we should have a comprehensive strategic plan, and there wasn't a vision. The president wasn't saying this is what we should be doing, but say we should have a plan and a process. So I think getting people involved, it seems like there was a lot of opportunity. There were all kinds of groups and working things over. I think one of them is measure the outcomes when you're done. One of them is a lot of communication while it's going on. One of them is having a clear process for how we're going to go about it. And I do think a lot of those things kind of happen. That would be a good thing to study. There are a couple back there, too.
I'm not sure whose hands are all up here, but...
So your description of the planned change, I forget exactly the term, was very much top-down. And I'm wondering about bottom and middle initiatives that can cause change. And that's particularly relevant, I think, at a university, but I'm wondering even, in social services agencies, I can imagine something more at the middle level, trying something, developing it, and...
Yeah, very important question. And they call it kind of administrative change. It is top-down because it starts with the administrator saying, we're going to do something. There's a whole other field in the human services, they call it staff-initiated organizational change, and there's kind of a growing literature on that, like people thinking, our procedures on how we do our intakes isn't that good, let's figure out a way to do it. So that can happen too. But the idea of this plan change is from organization development, and there's a value base there for high participation at all levels. I did an early in my career a project with the San Diego Fire Department. A new fire chief came in and he said, I want to make the fire department more progressive, more responsive. So it was top down. He's saying, I want to do this, but then we told him do some things. Survey everybody in the organization, feed the data back on what people see as the problems, form some problem-solving groups where they come up with ideas. So eventually it got to the bottom, but that is an issue. And I think leaders have to be comfortable letting go of control in this kind of a system. To listen, and maybe people are going to come up with ideas that they didn't think of, and they might be good ideas.
In your studies about different types of change, I believe you mentioned a change as a reaction, or as a response to external pressure, versus change that is proactive, more internally originated as an attempt to follow a vision. If these are two different kinds, as I believe they are, what does your research show about different kinds of requisites that are needed for each to be successful?
Yeah, good question. I haven't been able to isolate some examples of that, but the one that I wanted to study, in California there was a court decision that the judge said in child welfare, every child welfare case, they have to have a mental health assessment. So that was totally imposed from the outside, and if I had a grant, I could probably study that. So all 58 counties had to figure out how they're going to make sure that their child welfare clients get mental health services. But I think once it's mandated, and in our field, sometimes things are mandated, welfare reform, managed care, things like that. So an executive can either say, well, these jerks, these fools in Washington said we got to do this, so we got to do it. But they can frame it in terms of, as a leader, to say, this is an opportunity, that's a good point, we should be providing mental health services and child welfare, and let's figure out how to do it. But I think people react differently if they just think we're going to have to comply with something versus we see that this is going to make us able to provide better services and get better outcomes. So I think you can take a mandate and have people develop ownership over it eventually.